Well, thank you. Thank you for having me today. And the case, the title that I had, actually, I had pitched it to the valve team in one of our conferences and said, it's not luck if you're trying. What case come to everyone's mind? And there was silence. And I said, I know Paul well. I think he meant, it's better be lucky than good. And they gave me my last 50 cases. So I chose one of them and I need to do to advance there. So this is a patient. The story goes back to 2016. Back then, the patient was 88 years old with normal ejection fraction, presented acutely to the hospital with pulmonary edema, was found to have severe mitral regurgitation, torn chordae and leaflet, and he was thought to be not surgical candidate. And back then, he was rushed for a semi-urgent mitral clip. And this was an outside institution, and therefore they're playing okay. So this is the case that that was done. You see the ruptured chordae there with the flail leaflet, and they decided to do a mitral clip, which we all thought was appropriate. They did the first mitral clip. The decision was to go way medial, because as you see, the anatomy is very medial, and then to go a little bit medial to lateral on the clip. So the first clip was put in way medial, where the pathology is, and this is the picture after that. There was still MR, so they decided to put another clip a little bit lateral to that. And having a hard time advancing the slides. And this is 3D, and you'll see there is one clip that is buried right there in the commissure, and another clip right next to it. And they got a very good reduction in mitral regurgitation. Is there a way this clip can play? It's playing, but it's very slow. So this is the end results, and they were happy with the results, and you can see that there is a little mitral regurgitation left, and the patient did well. This is the release of that last clip that was placed in. This is the 3 clips, one in the medial and 2 right next to each other, and this is the end results. It was thought to be mild mitral regurgitation, and the patient did well and was discharged. The patient felt very well after the procedure. You can see that this is a patient that got acutely ill, presented 3 years later with the exact same thing, acute pulmonary edema, and he knew the drill. He said, "Doc, it seems like I need another clip." And this is the TEE that was done 3 years later in his presentation, and you'll see there's recurrent of acute mitral regurgitation. And the MR, there are 2 jets of MR. One is coming lateral to the most lateral clip, and there is one that is probably the most severe coming in between clip number 1 and clip number 2. And it seems like clip number 2 and clip number 3 have very good sealing. This is presented again to the heart team, and now this patient is 92 with recurrent severe mitral regurgitation, what to do. And we thought about options. I didn't even put surgery there because now he's 93. The options would be to go with another clip and maybe try to put a plug. And there's a fairly good sized series that was published by Paul and his colleagues about putting a plug in to cure leak in between mitral clips, and it's primarily between clips and commissures. So we thought about this, and then obviously running away is not a bad option. So the decision was to bring him in. He needed a clip anyway because there was a lateral jet, and the idea was to do a clip there and assess whether or not we need to go with a clip in between clip number 1 and clip number 2. So you see here we put a 1 clip lateral, and it was really difficult, but we were able to get a clip aligned right in between those 2 clips. We got it down, and it was one-way trip down to the ventricle, opened the clip with very good imaging. We were able to grasp both anterior and posterior leaflet, and we deployed that clip, and this is the end results. This traced to mild mitral regurgitation, and this is, you go back to 2016, this is when the fluoroscopy picture, when that the lineup of the 3 clips, and this is 3 years later, you'll see there is a little bit of change in the orientation of the clip, but not a whole lot. And this is when we put 1 clip lateral and 1 clip in between 2 clips, and it's a total of 5 clips right now with a trace MR. And this is the fluoroscopy that when you line up clips. So if you're trying to do multiple clips for severe mitral regurgitation, if you try hard, don't put them like that. If you want to put clips, put them like that. And that will help your mitral regurgitation. Thank you very much.